Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, I want to speak about the treatment of unexplained infertility according to the guidelines by the American Society for Reproductive Medicine. So, our objective is to know the recommendation, evidence-based, according to the Practice Committee of the American Society for Reproductive Medicine for treatment of unexplained infertility. This recommendation published in 2020 and the last updated in 2022. Okay, let us start with intrauterine insemination in natural cycle. Is it recommended or not? Just a natural cycle with spontaneous ovulation and do IUI, intrauterine insemination. Really, it is not recommended to perform IUI in natural cycle for treatment of unexplained infertility. Why? It is less effective. It is less effective than ovarian stimulation with IUI and likely no more effective than expectant management. And this is strong evidence, grade A evidence. Okay? Okay. So it is not recommended. What about using clomiphene citrate with intercourse with natural cycle also, but with clomiphene citrate, clomiphene citrate with intercourse. Okay? Is it recommended for unexplained infertility? No, it is not recommended. So, it is not recommended to use clomiphene citrate with timed intercourse as a treatment for unexplained infertility, as it is no more effective than expectant management, and this is grade B evidence. Okay, so up till now we said that IUI in natural cycle is not recommended. Clomiphene citrate with intercourse only, I mean without IUI, clomiphene citrate with intercourse only, timed intercourse means what? Means you tell the lady about the best time for ovulation by doing follow-up with transvaginal ultrasound and the folliculometry. Is this recommended? No, it is not recommended. Okay? Okay, let us go to the next. What about if we give the patient aromatase inhibitor with timed intercourse? It is not recommended to use letrozole, which is an aromatase inhibitor, with timed intercourse as a treatment for unexplained infertility, as it is no more effective than expectant management, and this grade B evidence. Okay? Okay. What about gonadotropins with intercourse? That means we will give gonadotropin and timed intercourse. It is not recommended also to use gonadotropin with timed intercourse in the treatment of unexplained infertility. Why? Because the studies report either no difference in pregnancy outcomes compared to ovarian stimulation with oral agents, or higher pregnancy rate associated with higher risk of multiple gestation pregnancy. Okay? And this grade B evidence. What about if we give the patient clomiphene citrate, then we did intrauterine insemination? Is it recommended or not? Yeah, it is recommended. It is recommended to use clomiphene citrate with IUI in the treatment of couples with unexplained infertility. And this is a strong recommendation, grade A evidence. What about if we give the patient aromatase inhibitor for induction of ovulation or stimulation with intrauterine insemination? Is it recommended? Yeah, it is recommended that letrozole with IUI treatment may be considered as an alternative regimen for couples with unexplained infertility. Why? Because the studies to date suggest similar efficacy. Of note, letrozole is not FDA approved for treatment of unexplained infertility, but is considered an effective and well-tolerated option. And this is grade A recommendation. Okay, so I can replace clomiphene citrate if there is no effect with clomiphene citrate. The priority with clomiphene citrate. If no effect or there is contraindication for any reason, I can use letrozole with IUI. So either clomiphene citrate with IUI or letrozole with IUI, intrauterine insemination. Okay? Okay. What about intrauterine insemination with combination of clomiphene citrate or letrozole and the gonadotropins? And the dose of gonadotropins here, low dose and the conventional dose. Okay, so here we are talking about giving the patient for stimulation of the ovary clomiphene citrate or letrozole plus gonadotropin, but in low dose and the conventional dose. Okay, is it recommended? No, it is not recommended to use letrozole or clomiphene citrate plus conventional dose gonadotropin with IR, as most studies associated with improved pregnancy rate over ovarian stimulation and the IUI with oral medication are also associated with an increased risk of multiple gestation pregnancy. And this is grade B evidence. What about if we give the patient low dose gonadotropin and then we did intrauterine insemination? Is it recommended? No, it is not recommended to use low-dose gonadotropin with IUI in the treatment of unexplained infertility, as it is more complex and expensive and likely no more effective than ovarian stimulation with oral medication with IUI. And this is grade B evidence. Okay, let us go to another situation. Can we give conventional dose gonadotropin and do intrauterine insemination? Is it recommended for unexplained infertility? No, it is not recommended to use conventional dose gonadotropin with IUI, as most studies associated with improved pregnancy rate over ovarian stimulation IUI with oral medication are also associated with a higher multiple gestation pregnancy rate. This is grade A evidence. What about timing of intrauterine insemination? Timing of intrauterine insemination. It is recommended that a single IUI be performed between 0 and 36 hours relative to HCG injection in ovarian stimulation with IUI treatment. And this is grade B evidence. I mean here, after, sorry, the time to give HCG, okay, after ovarian stimulation, okay, when to do IUI. We are talking here about the time of IUI. After giving HCG within 36 hours. Within 36 hours. Some prefer to be 24 or 36. And here we are talking about between 0 and 36 from HCG injection. From HCG injection. This is as regard the timing of intrauterine insemination. We described it according to the HCG injection. Okay, in relation to HCG injection. Within 0 and 36 hours. And this is grade B evidence. Okay, Let us go to the next. What about in vitro fertilization and treatment paradigms? It is recommended that couples with unexplained infertility initially undergo a course of ovarian stimulation and IUI. How many times I can do trial of ovarian stimulation and IUI? Okay, 3 to 4 cycles. I can give a chance 3 to 4 cycles with oral agent, as I said before, clomiphene citrate or letrozole. And for those unsuccessful with ovarian stimulation and IUI treatment with oral agent, IVF is now recommended rather than ovarian stimulation and the IUI with gonadotropin. And this is grade B evidence. Okay, at the end, we want to summarize the treatment of unexplained infertility in such a few lines. For most couples with unexplained infertility, the best initial therapy is a course of ovarian stimulation and the IUI with either clomiphene citrate or letrozole. So, please, when you see a case with unexplained infertility, start with her ovarian stimulation with clomiphene citrate or letrozole, then do IUI. Okay? How many cycles I can repeat? I can do 3 to 4 cycles. Okay? Okay. What if there is no response or it is unsuccessful? I can go ahead to IVF. This is my take-home message for you. Thank you, everybody. This is my box published on Amazon, textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology. Okay, you can go to my site on Amazon here. I write it in the description and in a comment. Also, you can see many lectures about infertility and the other topics related to gynecology and obstetrics and family planning in my YouTube channel, and this is the link of my YouTube channel. Another site belong to me is blogspot.com here, where you can find many articles and picture of some operations. Thank you, everybody. My best wishes for all of you.